Okay. All right. Well, today we're going to go ahead and do a cardiovascular assessment along with the heart assessment. So we're going to do the lungs and thorax portion as well as the heart. So this is Blake. Blake, can you say hi?
Hi.
Okay. All right. So the first thing we want to do is, first of all, we're gonna have him sitting up. You could do a couple of things laying down as well. I don't have the bed to do that here, so we're gonna do everything sitting up. But the first thing I'm gonna do is listen to his heart. And so what we have here are the second intercostal space on the right sternal border. We have the aortic area. On the left sternal border, just parallel to that, we have the pulmonic area. On the fourth intercostal space, we have the tricuspid area on the left sternal border. And then also on the fifth intercostal space, mid-clavicular line, we have the mitral area. Now, something that's added in this assessment is the Erb's point, which is anywhere from 2, 3, 4 in the intercostal spaces. So we'll inch down our stethoscope as we do that as well. His heart is probably a little bit smaller, the apex of it, so I might have to listen just a wee bit higher to get the sounds that I need, but the principle is the same. So, okay, so here we go. I'm just going to listen to your heart, so you just take normal breaths, okay?
Mm-hmm.
You don't have to breathe, just breathe normal. I'm just listening to your heart, not your lungs yet. Okay. And then we can inch down Erb's point. And I'm getting a nice strong beat right there in the apex of his heart. So one of the things that we can also do is not only listen with our diaphragm, but listen with our bell. So I'm going to do that as well. This is typically for lower pitch sounds. And it's good for hearing any heart murmurs, any abnormal beats of the heart. Okay, so he's good there. Once we've actually made our way down to the apex of the heart, this is our apical rate. And so we would count that actually for a full 60 seconds. And then classify it for the rate and the rhythm appropriately. So he has a regular heartbeat, and then I would count that for a full 60 seconds and give you a number. Yeah, so he has since he's a younger child, he's 9 years old, his heart rate's a little bit faster. So a couple of things, his breathing rate is also going to be a little bit faster, but I would listen to that as well. Okay, so for his breathing, it should probably be around 12 to 20, even at 8 to 12 years of age. And so we would take that into consideration. Okay. So we've done all the heart sounds. Then the next thing we're going to do this sitting up, here is that we're actually going to listen to the carotid artery. And it's always look, listen, feel. And that's how I remember it. And then in medical terms, we're talking about inspection, auscultation, and then palpation. Okay, so we're going to auscultate first his carotid artery. So I'm going to have you take a look to the right here, Blake. And for this, I would kind of displace the sternocleidomastoid muscle and feel kind of right in between here, between that and the esophagus, or the trachea. and see what I can feel here. And I do get a good pulse. Okay, and so you would classify that with rate and with rhythm as well. So if there are any abnormalities there, you would also note that, again, being like a murmur, or if you might think about it like a palpation or something like that, that would be something that would be abnormal there. So amplitude as well would be a way to rate that. So we always do both sides, so I'm going to have you take a look to the left. Same thing. And sitting up, this may be a little bit lower, where you would actually feel this pulse. Could all the way be down in the sternal notch here. You could find it. And then that would also be the place where you actually measure. Okay, so we've listened to the heart. We've done that. That covers the anterior portion there for that heart. And then the next thing that we're going to do is actually listen to the carotid artery. So I'm going to have you take a peek to the right over here. Okay, good. Take a peek to the left. Okay. Stay looking to the left there. Yeah, so it's difficult for me to hear him with the bell portion of my stethoscope. So I probably just stick with the diaphragm there. And again, you know, if you're as you're hearing things, you're listening to the whooshing sounds, any high pitched sounds, anything that doesn't match up to what the heart is actually doing. And then palpating wise, you maybe feel for thrills or something like that. That would show cause for concern or any abnormal indications there. Okay, so the next thing I'm going to do is chest. And so I'm coming in and I'm looking at his chest anteriorly. We're going to do everything on the anterior and on the posterior as well. Right now I'm just coming in inspecting. I can look at his skin, look at his shoulders, see the symmetry that he has, and then also just the configuration of his thoracic cage. And so everything looks fine there. I'll do the same thing on the posterior portion as well. So muscles, you know, he's a younger child and he's developing and things like that. So it's going to be a little bit different than what you would see in an adult, obviously. But there are no indications of abnormal conditions going on. His skin is consistent with his ethnicity, and he looks good here from the front. So as we've done the inspection, now we can go ahead and palpate. And before I do that, I'm gonna listen. I like to palpate last, so I'm gonna go ahead and listen to his lung fields. Okay. Inner 1/3 of the clavicle, I'm going to use the bell. Take a deep breath every time that the stethoscope touches your skin, okay? Okay. Okay. Then I'm going to work myself down. On the front, it's going to be 2, 4, and 6. Going side to side so you can compare bilaterally. So as I'm doing this, I can be listening for any crackles, any wheezing, anything abnormal that would indicate that I needed to listen further or do a deeper assessment. Yeah, so for him here, I had to move to the side just a little bit more than what I normally do on an adult patient to get a good, nice sound of his lobes there in his lungs. And so They were clear, bilaterally, free from any wheezing, crackles, anything like that. Okay, so again, we're sticking on the anterior side. So the next thing that we can do is actually palpate, okay? So I can palpate his chest, looking for any tenderness, any masses, any air accumulation, anything like that, and kind of follow along with his lung fields, okay? There's no tenderness. You don't feel any tenderness, right? Okay, so I don't feel anything tender there. No cause for concern there. Next thing we're going to do is a tactile fremitus on the anterior side. And so this is where I'm going to ask him to say the number 99 as I place my hand to your chest. And so you're looking for consistency as well, consistency in vibration, basically. And as we're getting into the lungs and listening to the lungs and stuff, and there's possible consolidation and fluid buildup. Sound travels differently in that way, and so typically you wouldn't hear a lot of these sounds when you're listening to them. When you're feeling them, you probably are going to hear probably feel the vibrations. But if there's buildup, fluid buildup, consolidation, something like that, then it would be a much clearer hearing of what is actually coming from the individual, from the patient. Okay, so when I touch your chest, go ahead and say 99.
99. 99.
Okay.
99. 99. 99.
Let me switch to saying here.
99.
Okay, and so I was able to feel the vibrations from him saying 99 across the chest equally. And so I don't feel like there's any cause for concern. That is a normal finding there. Okay, so the next thing we're going to do is the egophony. So I'm going to listen with my stethoscope as I have the patient say E every time I touch with the stethoscope, listening to the lung fields.
E. E.
Okay. Try it. Try it.
E.
Okay.
E. 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 E.
Do it one more time.
E. E.
Okay. And then we'll do one more.
E. E.
Okay. And so listening to the E sounds, I know there's concerns that if you hear an E to A transition, that's a cause for concern. That's an abnormal finding, and that could be, like I said, there could be some issues with fluid buildup, consolidation, things of that matter. So next one is the the bronchophony, and so we're going to say 99 while I listen as well. So every time I touch to your chest, say 99, okay?
99. 99. 99. 99. 99. 99. 99. 99.
Say it again.
99.
Okay, and I could hear that equally bilaterally through the lung fields, and so I don't believe that there's any cause for concern there. Okay, you doing all right? Okay, all right, so we've done that all on the front here, and then we're going to go ahead and do the back as well. So in addition to everything that we've done here on the front, on the anterior side, we're going to percuss the lung fields on the posterior side. So I'm going to have him swing his legs around over here so you can see his back. Okay? And again, starting with look, listen, feel. First one being an inspection. So I'm going to look at the symmetry of his shoulders, his muscles, his cage, his build here, his thoracic cage, and there's no issues with skin. Nothing that I can see that oxygen concerns throughout his skin, any cyanotic signs, anything like that. So I would say that this person is meeting the criteria in a normal manner. Okay. So the other thing we can do is then go ahead and, while we're talking about symmetry, let's go ahead and do the expansion here. And so you would actually squeeze. Go ahead and sit nice and straight up. There we go. And then have the patient take a long, deep breath. And as they take their deep breath, kind of watch your hands to see if there's symmetry and as far as his diaphragm and things like that moving appropriately. So take a nice deep breath. Yeah. And so you could see there how my hands actually went out and then back together appropriately. So one side is not heaving or lifting on the anterior side or the posterior side. They should be lifting appropriately. And so if someone has a disease state, issue with their lungs, things like that, one of them can kind of compensate for the other and cause issues, and you can see unilateral movement on the back side there. Okay, so we did the symmetric expansion. The next thing we're going to do is go ahead and palpate again for any masses, any tenderness, anything like that, and we kind of follow along the lung fields, posterior lung fields. Okay, so just relax, and I'll palpate here. And the posterior lung fields, by the way, are going to be your odd numbers. So it's going to be 1, 3, 7, 9. And then you would actually move laterally of the vertebral line to 9 as well. And compare everything in a ladder type formation, comparing bilaterally. Okay, so there's no masses that I can feel, nothing underneath his skin that I can feel, no tenderness that I can see. You know, he's not grimacing in his face, nothing like that, and nothing's been verbally indicated that there's any tenderness there. Okay, so the addition here for palpating is that we're going to actually percuss the posterior lungs. And so we're going to follow the lung fields. And you want to hear these notes and feel the changes for resonant notes versus dull notes. Dull notes. And so we'll compare it the same way, side to side. So as I moved down, these were kind of dull notes, and they were a little bit thicker in sound. And so to me that indicates that there's obviously tissue directly underneath, and you can kind of outline the organs that way on the front side and the posterior side, the anterior side and the posterior side. And when it gets into a more hollow space, they kind of becomes a little bit more resonant. And so a little kind of more tympanic sound there. Okay, so now we're going to go ahead and since I've palpated, I've inspected first, then I've palpated, and then now I'm going to auscultate. Okay, which typically it's inspection, auscultate, then palpate. Okay, so take a deep breath every time the stethoscope touches your skin. Okay. Okay. Job. And then, so now we're down here at 9. And then we're going to go lateral, 9. And let's go lateral again. Okay, do one more. Okay, so again, 1, 3, 7, 9, and then lateral, 9 for the lung fields. Again, we're listening for the same thing as we did on the anterior side. The lungs should sound clear. There should be free from wheezing, crackles, any whistling, anything like that that would be abnormal. Okay, that could denote that there's, there could be fibrosis, there could be fluid buildup, things like that that would need to be further checked on. For example, pneumonia or something like that. Okay, so now we're going to do these the test for the whispered pectriloquy. Okay, so as it touches your chest, I'm going to have you say 1, 2, 3. I'm going to have you whisper it. Okay. Touches your back. Okay. 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 Okay, so I was able to hear a little bit. I know that he is actually speaking the numbers 1, 2, 3 because I can see his mouth moving, and I could hear them up here. And a lot of that is just kind of resonant sounding coming through his area of the throat and things like that. Once you get down here, you shouldn't be able to hear it. If you can hear it, then like I said, there could be some consolidation, fluid buildup, things like that, because sound is going to travel better, further, and longer if that is the case. Okay, so let's do the bronchophony as well. And so this is going to be the 99. So every time that I place a stethoscope to your chest or to your back, say 99. Okay?
99, 99, 99, 99, 99, 99, 99, 99,
Okay.
99, 99.
Okay, so as we get lower in the lobes, it's really muffled. I can't hear it very clear. It's kind of a doling verbalization of the number 99. Up here is a lot more clear. As expected, down here it was not. So last one, let's do egophony. So that's going to be the E's. So do the same thing. Just say E when I touch touch the stethoscope to your back. Okay. Okay. Go ahead.
E. 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 E.
Okay. All right, so same results there as the previous assessment there. So last thing I'm going to do is actually place my hands and feel the vibrations of these two things as well. So you really do these anterior and posteriorly the same way here. So go ahead and say 99 when I place my hand to your back, okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, so exact same result. You can feel the vibrations up here above the scapula. Again, there's some, it's closer to the origin of the sound for one, and it's a little more hollow. There's not as much tissue to go through. And so down here it is a duller sound, and there's no abnormalities as far as hearing that sound clear and hearing the sound loud, just as though I was receiving it right in front of his face. And so so that his posterior lung fields look good. Okay, so we've done the anterior, we've done the posterior, and I believe that completes our cardiovascular, thorax, and heart portion of the assessment. So thank you so much.